So we are very honored to have you here. We thank you for being here. And I understand you'll also be joining us when the Secretary and the remarks on the panel this evening, when the 9/11 Commission and Governor Keane. So I just want to welcome you on behalf of INVICTM. I guess I can say Lincoln alumni too. And Mary, we all know Mary, who is the Executive Director of Voices. Yes. So I'm going to actually do the introductions, but I'm also your moderator for this panel, so it's quite an honor to do that. And I'm going to start by saying, the theme of this whole symposium, this portion today, is about building trust in turbulent times. And so in this panel, you're going to hear from victim advocates who will share their personal and professional experience in responding to the needs of those impacted by tragedy in the United States and abroad. Panelists will highlight lessons learned in supporting victims' families, survivors, responders, and the community at large. So I just want to we had the privilege of listening to some excellent speakers this morning, and there's kind of three kind of top things that I want to just put out there. And the first is, when we talk about meeting the needs and supporting victims, families, and first responders and all those impacted, we all use the word circles of impact. And we use the word circles of impact because we recognize that, of course, people who have lost loved ones, people who have been survivors, people who have been directly impacted. But then, of course, there's the responders, there's other people who have lost loved ones, and then as you bring the circles out, the community itself. And so when you hear us speak, and these three panelists speak, they all recognize the amount of impact in those circles of impact. I think it's easy to sometimes say there's a legal definition of victims, but as we all know, that's not what needs to be applied at a time of tragedy. The second is, when we talk about what we're going to speak to today about the victim-centered approach, we talk about it in terms of a continuum, because ideally prevention works. And John Miller spoke to that this morning about those victims who actually didn't become victims because the law enforcement intelligence communities were able to stop that. So when we look at the continuum, it is about the pre-planning as well, which is probably one of the key messages you'll hear from this panel as well. But it's also the immediate time when the tragedy happens, and then in the short, medium, and long term. And as many people in this room know, your journey is a lifelong journey beyond any criminal justice system. It is something that you will carry with you lifelong. And so having made those kind of initial comments, it is my pleasure to introduce, I don't know if Mary needs any introduction, but Mary Fetchet, Executive Director of Voices, Center for Resilience. And next we have Dr. Anne Verst, and Anne is by the way, a proud member of INVICTM, founding member of INVICTM. She is also the psychosocial manager at Belgian Public Health and is responsible for setting up the new center in Belgium, Center of Expertise for Psychosocial Support Following Collective Emergencies. And certainly not last, but Pauline Okroglic, who is from France INVICTM, and Pauline is also a member of INVICTM, so bienvenue, c'est vraiment plaisir, vous êtes ici aujourd'hui avec nous. So I just wanted to welcome everyone here, and I'm going to start off with a really simple, and I think, John, you said it, these people here, the panelists, have so much knowledge, so much experience to share with you. I think it's best coming from you. If you could just tell us a little bit about yourself and about your organization. So Mary, I'm going to start with you.
Well, thanks, Sue, and welcome everyone to the symposium this afternoon, especially those that are just joining us. My name's Mary Fetchet, and on September 11th, my husband Frank and I lost our son Brad, who was murdered in the terrorist attacks. He was on the 89th floor of Tower 2. I was, at the time, working as a clinical social worker in an outpatient mental health clinic in Milford, Connecticut, about a half hour from our home. But I had attended a mental health conference back in the late 90s, and a woman spoke that lost her daughter in the Oklahoma City bombing. And it was because of her presentation, this powerful film that she showed, the Murray building before it was bombed, as the bombing occurred, and it ended with her walking through the memorial, pointing out that Sue sat here, Tom sat here, here was the nursery. But what she said after the film was that there was a rippling effect through the whole community, that there was a higher incidence of depression, anxiety. They didn't call it PTSD back in the late 90s, but in fact PTSD, suicide, substance abuse, spousal abuse, and all of the factors that mental health can contribute to. like divorce, as an example. So I actually decided, based on that presentation, to go through the training at our clinic to be part of the response team. Now, I never returned to the clinic, but many of my colleagues there responded to the Newtown shooting, which again was about a half hour from the clinic, and they remained there for many years. So that was sort of the backdrop to 9/11. So when 9/11 happened, of course, most of the families were at home waiting to hear from their loved ones. They didn't know if they were dead or alive, and we were no different than other family members. And so as I started going into New York City, there were family assistance centers set up in Boston, New York City, New Jersey, Washington, D.C., and of course, Shanksville, Pennsylvania. And I was struck by going to the Family Assistance Center that was set up along the West Side Highway, and the thousands of people that were flooding in from around the country and around the world. There were 2,977 that died on 9/11, but 2,753 that died at the World Trade Center site. And there were 90, as we know now, 93 countries that lost citizens. And people didn't know, I mean, most people didn't use computers. I mean, they didn't email, you know, they didn't use the internet. And so it was really, really challenging for them to find out information. And for most families, there were women that lost their husbands. The last thing that they could do is travel into New York City and go to the Family Assistance Center. Number one, I think people were fearful, was there going to be another attack? And then certainly they had to care for their children at home. And it was very unpredictable because at that point, they didn't have an income coming in either, and they had lost the breadwinner. So we started holding weekly meetings in my home, probably much to Frank's chagrin. I reached out to all of the families in Connecticut, and we started holding weekly meetings in our home. And we would travel into New York City and collect information. You know, there were almost printing presses at the Family Assistance Center because, as I said, people didn't use the internet, and there were thousands of organizations responding. So I remember writing a letter to President Bush in October of 2001 and talking to him about two things. One is that I felt that there were going to be long-term needs by not just the families, but the community as a whole. I mean, you only had to be in New York City, and I spent a lot of time there to smell the air, you know, the toxic air that so many people spent months being exposed to. So I felt very strongly that people were going to have long-term needs. And the second thing I wanted was an investigation. You only had to read, and we'll talk about it this evening, but you only had to read the newspaper to know that the FBI knew this and it wasn't communicated to that. So organizations weren't communicating within and among their organizations. And that's really why, you know, linked is so important, you know, to see the progress that's been made. So over the years, we've provided probably a couple 100,000 hours of social service support. We've held over 2,200 support groups. In the early days, it was via telephone. Zoom was, you know, something that we would have loved to have had in place, you know, 21 years ago. But nevertheless, we were able to make a quick shift and use Zoom now for our support groups. We've held, this is our 21st annual conference here, but we've actually held 35 conferences because we did conferences in other communities in Washington, D.C., New Jersey, and so forth. And so the public policy was very important too. We did a lot of advocacy work Certainly we worked with the city to provide information on communicating with families. We helped plan the 3-month, the 6-month, the 9-month, the annual commemorative events. And memorialization was really important to our families too. So again, we sort of thought outside the box. While the museum was being built, how could we commemorate the lives that were lost? So in 2005, we launched the Living Memorial. And back in those days, traveled with huge flatbeds to meet with families, and we collected over 87,000 photographs. So when the museum was built, we were able to provide them, with the permission of the families, the collection of photographs. So that's probably the short story. But we've also established wonderful relationships with hundreds of organizations that have provided support over the years. I think the most important, certainly, is our work from the very beginning with the medical examiner's office. And we continue to work with them as they still have about 7,000 remains in their possession and over 1,100 families that have never been 1,100 victims that have never been identified, and they're continuing to use advanced DNA processes with hopes that they'll be able to identify those victims. The other one is the memorial. I mean, that is and continues to be a really important partnership that we have. And then again today, certainly with Linked and INVICTM, because much like most people in the room, we want to leave a legacy that we're going to move things forward through our collaborations.
Thanks, Mary. Anne.
Thank you. First of all, I want to thank Voices, of course, and our colleagues at INVICTM and Linked for having me as well and having me on this panel. It's always such a pleasure and an honor to be surrounded by such great people. So my name is Anne Verelst. I work for the Belgian government at the moment. At the moment, I say, because it's not been so long. It's been a couple of months that I'm there. I work as a psychosocial manager. It's a function that you don't have in a lot of other countries, but a psychosocial manager in the Belgian government is embedded in the crisis response. So what do we do next to the fire department, the police, the medical services? We get called immediately whenever there's a collective incident. It can be a terrorist attack, it can be a huge disaster, or a little bit of a smaller disaster, like a big fire in an apartment building. We get called actually to bring the victim's lens to the table. And we call it psychosocial in Belgium, but in Belgium, everything that's not medical but has to do with those affected or victims is psychosocial. So it can be practical, it can be making sure people have shelter, food. It can also be really the psychosocial and emotional response. So it's a special function, which is, I think, very important to make sure that both in the operational command, because we're on the scene often very quickly, but also on that more strategic level during the emergency phase, that decisions are made with that psychosocial lens. And that is what me and my colleagues in the Belgian government try to do. It can be, for instance, during a terrorist attack or the terrorist attack in Brussels, it were decisions like there was a third bomb that didn't explode, so it had to be exploded, but a lot of people in the reception centers, a lot of victims were still around, so it meant us bringing to the table, or my colleagues at that time, because I wasn't there yet, but bringing to the table the fact that we need to communicate it to those affected. And how do we communicate it? It's bringing that victim lens to each operational decision in the emergency phase. We're a small country, but we have a lot of governments and a lot of procedures. So it means that I'm there, and like my colleagues as social managers, for that immediate phase. And then we go to the regional responsibilities, such as the aftercare and the midterm. When we talk a bit more during the panel, you'll see that also the complexity of the structure in Belgium makes that we need to put systems in place to ensure that the needs of victims are met, not only in the beginning and a little bit in the middle, but that it's a continuum of response, and that's why we need to really work together. Maybe just
no, go ahead.
A little bit. I was actually asked by the Belgian government, of course, together with my colleagues, to set up the Center of Expertise on Psychosocial Support, because it's one of the big takeaways of the Brussels attacks. We know the psychosocial response after terrorist attacks is incredibly important, and that it's important to know what works, what is needed, what do we have to put in place as good interventions? So that's my job, to make sure that or together with my colleagues, of course, that we get the right expertise around the table, that we do research to make sure what works and what needs to be put in place, to then translate it not only in procedures and tools, but also in legislation and interventions. So that's...
Thank you, Anne.
Yeah.
Now, Pauline is here from INVICTM, and I've asked Pauline, she's going to come up, and she's got 5 slides, because they have a kind of a unique processes in place in France that many of you may not have seen before, but many of them we look at through INVICTM. And by the way, I should mention that what we do in INVICTM is we listen to the expert, we listen to the lessons learned, we listen to the voice of victims, we listen to law enforcement, and then we take back to our own countries or work together globally to affect change. And so how you make the best decisions for your organizations is by having the best information possible upon which to do that. And so I think what you've seen from this morning is the importance of those relationships. Notice I'm not using the word partnerships, relationships, being able to do that. And that is the strength of INVICTM, is that we have that flexibility. We learn from each other. We can also be reactive. So Pauline is from INVICTM. They sit at the government table. They have a different approach. They've also, and you're going to hear a little bit more about Pauline, but I thought it would be really important to have someone from a different country who has, I'm going to say, different structures than many of us have seen before, but are quite effective, including, and she's going to talk a little bit later about the fact that her organization has been in support to not only the November 13 trials that just completed, but is now in support of the Nice attack trials. So Pauline, if I'm going to give you the podium, and I'm going to sit down for a minute.
May I have the presentation on display, please? Okay, thank you. That's good. Okay, hello everyone. First of all, I'd like to thank Voices, INVICTM, and Linked for having me, and to give me the opportunity to present to you the organization that I represent, its work in general, and more specifically during the trial of the terrorist attacks of November 13, 2015. So let me introduce myself. I'm Pauline Okroglic. I'm a legal officer dedicated to victim support and European affairs and international affairs. Yes, it works. So I work for the Federation France Victimes, the French Federation of Victim Support Associations. In France, you have to know that the mission of supporting victims was entrusted to associations and the non-public and the non-profit sector more than 40 years ago. And it is within this framework that France Victimes, which was called INVICTM at the time, was created in 1986. Today, France Victims Network has 130 associations throughout France, so mainland and overseas. And each year, this network of associations welcomes more than 300,000 victims. The Federation France Victimes is part and has co-founded the European network Victim Support Europe and is a member of INVICTM, as Sue was mentioning before. So you have to know that this network of associations is made of generalist associations that specialized in judicial accompaniment, which means that the France Victim Associations help and support anyone who considers themselves a victim, whatever the offense. So, for instance, domestic violence, harassment, theft, natural disasters, and of course, terrorism. France Victim manages its network of associations by organizing an equal access to quality services and assisting the associations in their mission of assistance and support to all victims. So you also have to know that France Victim also manages the 116 helpline, which is the European victim support number. where a team of professionals listen and evaluate the victim's needs and provide information and proceed to referrals to dedicated organizations that will bring support to them. The 130 France Victims Victim Support Associations are composed of 1,610 professionals, mainly jurists, psychologists, and social workers, both employees and volunteers, working in over 850 locations, which includes around 200 police stations and gendarmerie. Bear with me. I'm French and I speak English, but that will happen. That's already extraordinary, right? So these associations, our associations, they provide multidisciplinary support, primarily legal support, psychological support, and social support. And the services are all free and confidential in respect with the victim's autonomy of decision. The associations have to obtain victims' consent for any process. They cannot represent victims in court, nor refer them to a designated professional. As for our association's framework of intervention, so they intervene towards victims whenever they need it. It can be in the urgency of an institutional request, immediately at the request of the victim, during the execution of a sentence, and so on. The support brought to victims is always in the long term and as long as the victims need it. The associations of our network are also fully integrated into emergency mechanisms when collective events happened. So Anne talked about it before, but what we call collective events would be, for instance, a large-scale incident, natural disasters, or terrorist attacks, for instance. And they adapt the support to victims. So it is even more so the case during exceptional or sensitive trials, as we call it, during which specific support mechanisms are deployed to fit victims' needs as best as possible. To be efficient, support has to be tailor-made to each victim depending on their needs, and long-term. Support does not end when the trial ends, for instance, or for any procedure for that matter. In terms of terrorism, and just to give you an idea of the last 11 years, the France Victim Network intervened following 57 attacks between 2011 and 2022. 24 were in France and 33 abroad involving French victims, which represented more than 10,000 people helped by the France Victim Associations. The intervention of the victim support associations of France Victim is part of a very precise framework. Since systematically in these situations, we are mobilized by public authorities, mostly by the Ministry of Justice, which at the national level requests the Fédération France Victim, and then the Public Prosecutor's Office mobilizes the local association. Note that we have had a prosecutor's office dedicated to terrorism since 2019, located in Paris, which systematically takes action when terrorist attacks occur in France. It also means that the France Victim Association in Paris is always mobilized to provide support during the trial and has therefore developed an expertise regarding help and support for victims during trial through several trials since 2020. But I will get into more details later on during this roundtable. Thank you very much for your attention.
Merci, Pauline.
You're welcome. Yep, here you go.
I'm going to start with a fairly broad question, and Mary, I'm going to start with you. And the question is, how did your organization or organizations respond to the 9/11 attack in the immediate response, and what did you learn from that?
How long do we have? I think immediately I recognized there was a need. You only had to be at the Family Assistance Center to see the confusion of these people that were coming in to get information. As I said, there were families from 93 countries. Some of the challenges certainly was getting information. How are we going to provide information and services to families that lived in 93 countries? So when you think about, say, the medical examiner as an example, they had to collect DNA samples from family members that lived in 93 countries, and then they had to collect, all of the remains that they had. preserve them, and then go about the process of making those identifications. And so when you think about that's just one system. The city, was mobilized, and there were hundreds of, or maybe thousands of organizations that were providing some kind of service. But what I saw from my viewpoint, it was a value that I had as a social worker, is continuity of care and looking at individuals holistically, because you might be able to be providing mental health support, but truly, the social workers, many of them living in New York themselves, were affected, but yet they were expected to provide services, and they were horrified to hear about the specifics related to the identification of remains, just as one topic. So I think that in the immediate, I saw as an immediate need, trying to get as much information as we could, traveling into New York, bringing it back to the families, and then as the organization grew, sharing it with people that lived around the country. I think that it would have been very hard for any organization to advocate on our behalf. And I saw that as a role that we could play as we started going into New York City. The city was actually looking for somebody that could provide them some kind of, guidance on how to work with families or what the families needed. And everything that affected the families affected their well-being. So when you think about the Victims' Compensation Fund and how extremely complicated and challenging that was for people to have to tell who their loved one was and equate that to a compensation for their life. That was a horrific process. And working with the property clerk, the medical examiner, the LMDC that was working in the recovery effort. So I think that the lessons learned that I've found is there's often a mistrust among victims for anyone in authority, particularly around say an investigation that's not happening, because they really need the support and they need the answers and they need someone that can advocate on their behalf. So I think that was really, one of the main messages that I have is looking at victims' family members and the broader population as in a holistic way. They may or may not need mental health, but they're going to need information and they're going to need access to resources.
Thanks, Mary. Anne?
Yeah, I'll look maybe at the Brussels attacks, because from the Belgian government we have a little bit of expertise there, of the lessons learned. I have to tell you that at that point I was working with Victim Support Europe as a deputy director. So I was looking really from that civil society lens. So I have a lot of things that I could say didn't go so well. But I think it's important to look at what we saw there and also what is learned ever since. I think one of the things to pick up on is registration. And registration, it sounds like an administrative or very boring topic, but I think after the Brussels attacks is one of the biggest lessons we've learned of things that went wrong. What do I mean? We had 3 bomb blasts, 2 in the Brussels airport, 1 in the subway in Brussels, a bit further away. And we had 32 people who unfortunately died, and then thousands of people who were at the scene. At that point, we didn't have a proper system in place to make sure that we registered everybody who was there. So I was, at that point, as Victim Support Europe, we were asked to liaise the cross-border victims with the victim support organization in their country. So, of course, we needed information on their identity as well. We worked closely with the government, but what we saw, and there's a lot of pictures that I could show you about how lists of people, personal data was used, collected. it was messy. It was names written down on this list, then another list, then the police had another list, and there were so many lists, and getting them together was such a hassle, which meant a lot of data got lost. We didn't get all the contact details, we didn't get the right names. It took so long to determine where people were, who was there, and up to this day, there's still people that we don't know were there. What did it have as an impact? That, for instance, victims who had to wait, sometimes people who were missing some of their loved ones had to wait days for the whole identification process. Of course, it takes time. But because there was so little information about who was there, who was in which reception center, who was in the hospital, that it was excruciating for them. It was very traumatizing. People had to drive from hospital to check if their loved one was there or not. So I think registration had such a huge impact, and it's still, if you talk to victims in Belgium, one of the most traumatizing aspects of this whole, of this horrific experience they went through these days after, because they couldn't find who they were looking for. And in its essence, it has an enormous impact not only in this immediate phase, but also in the long term, especially cross-border victims, especially a whole list of victims. They just fell through the cracks. We never got to them to talk to them about their rights, about support services. They couldn't access compensation, and now I still often think about people somewhere in the world that were in Brussels at the time that needed the help and that never got it. So I think that is a huge lesson learned, and something that I'm proud of that the Belgian government has taken up, because it came out as a recommendation by the Parliament, the Parliamentary Investigative Committee, to get a better registration system. So the last 2-3 years, my colleagues at the government have been working their asses off to create a really good registration system. A good registration system for Belgium. It works different in different countries, but for us, we have now, everybody who's on the scene gets a bracelet, is scanned, we get the list. As we speak, the first minutes, hours, we get the list of who is where, also who is transported to which hospital, who has been talking to DVI services, who is missing. So it's all the people who call in the telephone helpline. We get all this information in one list, which makes it much, much easier to grasp who is there, but also afterwards for the support services, for all the other governments and people who need to contact victims, to get everybody involved the right information to make sure that people can exercise their rights. Because registration, not being registered, has such a huge impact on what you get afterwards. So this is just one of the, for me, big lessons, and also a lesson that we did something with.
By the way, not unique to Belgium. One of the number one issues we often discuss about is the issue, we might use the word victims list, and privacy and the challenges around that. And we've seen, for example, I know, Kevin, you're speaking to Las Vegas, but the FBI has a page called Seeking Victims, and they were able to quickly find. These are also your, as you know, as the law enforcement in the back of the room, your witnesses, many of them, and getting that as quickly as possible in the information. So I know the UK has the major incident portal and is working on some different push notifications. Here in Canada, we have the Alert Ready systems are now being used much more frequently. So there's different things that are in place, but it's how do you gather this information? And the other point that I really that Anne pointed out is, if you're not registered as a victim, because the law says you have certain things that you have access to, like compensation. I know we're a little jealous of France because you get quite a big chunk early on, but it's also identifying, and I know you had challenges around using geographic and bloodlines to look at who was a victim, depending on the niece, for example, in the geographic area. So there's a lot of, what I'm trying to say here is we need to be hearing from what's going on in the rest of the world so we can adapt to what would work within our own countries. Pauline, over to you.
For us, as for me, I'm going to stay focused on the attacks of November 13 because this was one of the largest terrorist attacks that we have had in the last decades. So there was a lot that was created on the spot, a lot that we anticipated, but a lot that we learned also. So immediately after the attack, really immediately, you had a crisis hotline that was set up within the Ministry of Foreign Affairs. where France Victim and other associations nearby took part to respond to the calls to families, close ones, victims, everyone who was concerned and had questions and wanted to know about the status of people that were there where the attacks occurred, which has changed, and that would be also a lesson learned for this one, because now this crisis hotline became an interministerial crisis hotline, which is deployed within the Ministry of what is it? Home Affairs? No, how do you call it? Of Internal Affairs, sorry. The Ministry of Internal Affairs, and now can be deployed for any major crisis. So it can be for any large-scale event. There will be this hotline that will be deployed within the Ministry of Internal Affairs, where you will have a first line of response by the Red Cross, for instance, to answer to the really priority, the first needs of victims. And then there is a second line of response where France Victim and some staff of the Ministry of Justice to answer questions about victims' rights, victim support, and to write down any worrying desperation. So we can send that to law enforcement, and they can investigate whether that person was registered within a hospital or not, and so we can let people know about their loved ones who have been missing. Another thing that was established right on the spot was what we call families reception centers. It's kind of a one-stop shop where victims can find all of the relevant actors. So you will have law enforcement, you will have victim support associations, you will have victims associations, you will have lawyers, the Red Cross. And that is only deployed during the emergency phase to answer to the very first needs of victims on the spot. And what we have developed after that is centers that are permanent, that are still one-stop shops where victims can find support and any help from all of the institutions. So there you can find representative of the Guarantee Fund, which is our compensation mechanism for victims. Again, lawyers, victim support associations, and victims associations. So that would be a second lesson learned. Also, you have to know that all of this, the creation of these institutions, of these centers, where you have all of the relevant actors that are inside this one-stop shop, is only possible if all of the relevant actors have been sitting down together at the same table to anticipate as much as possible the emergency phase and what will be needed. So for that, we have what we call local victim support committees, which are deployed in all departments in France, that are under the control of the local prefect and the local public prosecutors, where they gather all of these actors around the same table to anticipate, as I was saying, as much as possible the emergency phase, but also to discuss any victim support matter in general, not only for victims of terrorism. Also, you have to know that after the emergency phase, France Victim receives the list of victims. So for us, it's a bit easier because everything goes through the prosecutor, and the prosecutor then sends us the information. So we can then in turn mobilize all of our associations so they can proactively offer support to victims, which is also something extremely important that I would highly recommend. Proactivity. Do not wait for victims to find the information by themselves that such organization exists and what they can do for them, because information is still the main issue. How can we make sure that victims know that we exist? So when we receive such lists, we can proactively contact them, explain who we are, offer them support so they are not left alone and completely abandoned, because this is one other main issue, is that victims do not have information, feel that they are completely abandoned. And then when they receive support, but so much later on, they will say, well, that I needed you before. And where are you now? And you're just coming up to me now, and this is too late. And to build that trust with victims then is going to be extremely difficult. So that's why recurring contacts with victims proactively ensures that victims know that they are supported, know that the system knows that they exist, and so they can trust not only our organizations, but also the justice system.
Can I pick up on that? I think after, of course, things have changed significantly since 9/11, but nevertheless, I can't stress enough the importance of the pre-planning. Because I've seen after many of these other tragedies, you have the Red Cross has their list, the medical examiner has their list, and then at the end of the day, who's really going to be providing the services is an organization like ours. And they're not even sharing the list among themselves, nor are they sharing information about resources that are available. So I think this is something that really to have all of the stakeholders, and I would say, it's not, it's certainly law enforcement has to be at the table, but you also have to have emergency managers, people that are responding to some of these tragedies. I know I spent some time in Newtown, and I was horrified to see the spreadsheets and the half-hour turnovers that they had in answering the phone. So they'd contact somebody, they wouldn't reach them, they'd leave their half-hour shift, and then somebody else would be there when the person called back, and they'd have to refer to the spreadsheet. You know, I said a spreadsheet in our organization is a 4-letter word. You really need to have a database in place, and you need to be partnered with people that, if not sharing your list, you're sharing information.
We talked about the immediate phase, but as we know, once the first 4 or 5 days goes by, we get into kind of the medium and longer term. And I know there's many lessons learned. And Mary, for example, you talk about the fact that you've 21 years you've been in support and working with families from 9/11 and responders, and how their needs change over time, and how that has to be, that continuity has to be there, and yet seems to be one of the things that many of us in our countries don't have. You have the long-term commitment with France Victim, but in many, I'll speak to Canadian, there are services available, but it's not that seamlessness. It's not that where do you go and where do you find the information. Somebody was mentioning to me recently where they had such a great relationship with family liaison officers, but over time that relationship had to end, but they still had needs. So I wonder if you could speak a little bit about that.
Well, there were about, Morgan Stanley did an analysis for us, and there were over 400,000 people that survived the attacks here in New York City. There were 90,000 responders. Now, that's not including the people that came in from other countries to respond. And, when you think about the circle of impact, which is really, I think, a concept that we've developed among ourselves, that, you certainly start with the victims and the survivors that are injured. But what you don't recognize that over time, there are other people that are either responding or impacted by that tragedy. They could have lost a loved one. They could have lost hundreds of, if they worked at Cantor Fitzgerald, they lost 600 colleagues that day. Or the firefighters that still today, are losing their colleagues, certainly in the law enforcement too. So the way that our government works is the federal funding lasts for about, a year and a half, 2 years. And it's typically given to organizations that are federal organizations or organizations like mental health providers and so forth. But when that ends, it's about the time that the people outside that initial circle, recognize, gee, I have PTSD and I need help. And so what we've seen, certainly with 9/11, we still have a lot of unresolved issues. They're still identifying remains. Guantanamo, who knows when that will ever be resolved. And then the lawsuits, the Saudi suits, are still trying to seek information from the federal government that may be holding people accountable that funded or played some part in, the loss of almost 3,000 lives. So when you think about these issues that are 21 years later not resolved, and you look at the people that lived in 93 countries and the people that weren't identified as being affected. I think the medical issues isn't prevalent in some of these other tragedies, but I think that we really have to think about how are we going to support people outside that concentric circle. And I don't see any vision at all for really identifying that in the immediate aftermath. And I think that's something that we really have to consider.
Now, I know all of us at INVICTM talk about this all the time, about the importance of pre-planning. And I would often get asked by law enforcement, well, in terms of why it's so important that you pre-plan. And what I do is I usually put up, it comes from Mary originally, but I call it the little protocol list. And it's everything from, death notification to management of personal effects to all those extra things. You all have excellent response strategies. Some of you are better prepared in your countries, and everyone's unique and has different organizational structures and capacities. But one of the things is, I would always say, if you don't have a protocol in place for these 20, the list is now 25, but if you don't have a list in place for this, you're not prepared to respond, because it's too late. As we all know, once the crisis happens, you're in it and you're operationalized and you're dealing with the crisis. So the time to be thinking about it, and that is the gift you have today, is to be thinking about what you have in place, and do you have what's necessary over and above your regular critical incident response that needs to be in place to address some of these. Well, thank you, Mary, because that's such an important topic. And in the medium and long, go ahead, build off that.
Maybe I can listening to Mary, she's talking about so many different types of impact that people still live through and live every day with, sometimes decades later. And I think that is important to take on in the pre-planning. We know that it can happen. We've heard victims. We've listened to them. I think also as governments or as organizations, we have the responsibility to do something with that information. We know by now as well that it's a holistic approach that's the only approach that would work. If you, for instance, only think about the psychosocial or mental health part, but you do nothing about the mountains of an administrative burden on victims, know for sure that a couple of years later the mental health part will surge up again. So we need to understand that they are so interlinked that if you treat the medical but don't think about the other parts, the social impact of, for instance, having lost one of your legs while you were a sportsman before the event. So what do we do with that information? We try to understand it, we try to look at the immediate impact, but it also means that we need to have the right people around the table for the mid and long term, not at the time that we need them and see that it's an issue. We should talk to them in the pre-planning phase. Make sure that we have people around the table that can help with helping people find a new job if they need to, deal with certain medical difficulties, and the mental health specialists. So I think that is important if we look at this long-term planning. I think one point I want to make as well is of course, and Mary always stresses the importance of looking at the first responders as well. And I think there we need to be careful to not just think of, okay, a mental health trajectory after a terrorist attack is X or Y, and we can expect that people have difficulties immediately after an event, or maybe 2-3 months. We know from some research that first responders sometimes start having symptoms even years later. So we need to think differently about this medium long term. We need to think differently of what is the trajectory that a victim or a first responder would go through. We need to be vigilant for years and years to come. And I think that is a nice piece that is in the legislation, for instance, at the European level, and civil society organizations. And I have to say, Victim Support Europe as well played an important role in making sure that now in the Combating Terrorism Directive, it is stated that victims of terrorism should be supported medically, physically, on all levels for as long as they need. And that can mean decades, even generations, if need be. So that's...
And just to pick up on what, I'm sorry to interject, but you're triggering some thoughts, in our conversation. I think the registration is as important to know who was there that responded. And we had a lot of people after 9/11 that weren't necessarily credentialed individuals going down there. I think, again, about the registration, I don't know how many times people asked me who I lost, where he worked, how old was he, how many other children do I have, time and time again. And 21 years later, we're hearing this with responders and survivors that are sick, that they have to provide, where they were, what symptoms they have, and go through this almost interrogation 21 years later. So what does that do for somebody that hasn't had services and has PTSD? Are they ever going to be able to get through that process? And so I think the registration is really important, and I think that's one remedy, really, to drilling these people time and time again.
Pauline, you have a unique perspective that I think we don't often hear about in terms of the kind of from the time of tragedy through to a court process. And I've had the privilege of listening to what France Victim has done, particularly through the November 13th trials as a perfect example, because it's important that connection, and it's what we're talking about here. There's the tragedy, there's the short-term response, but to remain connected through, it may be an inquest and inquiry, it may be a criminal trial. But you recently had to manage quite a large trial with quite a large number of victims, witnesses, and people that you were in support of. I wonder if you could tell us a little bit about that.
Yes, of course. I have numbers, so bear with me. But just to remind you, for this trial, there were 20 accused and 14 were present, including the only terrorist still alive after these attacks. And you have to know that this trial was really a challenge because it involved 2,630 civil parties, which means that they are victims who are part of the proceedings. This trial lasted for 149 days, so it's around 10 months in total. And in these events, you had over 131 victims who died, more than 400 that were injured, and thousands who were impacted psychologically. And that meant that we had to do these things right for all of these people who were waiting so much about this trial. And the scale of it meant that we had to build an entire new courtroom that would be able to fit as many victims and civil parties as possible. There were 600 people who were able to fit in this courtroom. We had 10 retransmissions rooms that were open within the jurisdiction, so people who could not go within the main courtroom could still follow the trial. And this is actually quite an interesting experience. Unfortunately, that's really sad that I have to put it that way, that it was an experience, but it really enhanced the importance of pre-planning first, anticipating as much as possible, because for this trial, we started organizing everything with all of the actors, so with the jurisdiction, the magistrates, the lawyers, the victims' associations, and so on, 2 years prior to the trial. And we had, it turned out that four main focus points resulted from all of this experience. So the first one was to associate. So to associate victims so their voices could be heard. You have to know that since the very beginning, so 2 years prior when we started organizing this trial, victims were involved in all the preparatory phase of the organization of the trial. So not only victims associations, but also victim support associations. So for us, as I was saying, it was the Parisian Association. So along with France Victims and all of the actors of the jurisdiction, they were part of working groups to determine what would be best for victims on the day of. And that was really important, so victims would feel considered. So that's the second point. The second action would be to consider the victims. So not only were their voices heard, but they were taken into consideration. During these preparatory meetings, victims expressed their concerns towards the victims who would not be able to go to Paris to follow the trial. And to find a solution to this issue, they proposed the creation of an internet radio. And you have to know that this internet radio mechanism now has entered into law. I mean, it's been into law since the end of 2020. So the main point of this internet radio was for victims to follow the trial remotely, audio only, with a slight delay of 30 minutes. So victims would be able to follow the trial whether they would, I mean, in case they did not want to go to Paris or they could not go to Paris to attend the trial. Also, you have to know that we had to adapt all of our system. And to better take the victims into consideration, we decided to change, we, in France, we decided to change the order of the proceedings. So the trial opened with the victims' testimonies, which lasted for 5 weeks. They had unlimited time to testify and say as much as they wanted. It was really important to also to show the victims that they mattered and that their voices were at the heart of this trial. And so the president listened to all of the victims who wanted to testify. I think there were 350 victims that testified at the beginning of the trial. And then later on, it turned out that they had to organize a second session of testimonies because a lot of victims in the end wanted to testify and they changed their mind throughout the trial. So they decided to organize a second session of testimonies for 2 weeks in May. And I think that, it was out of the 2,630 civil parties, over 400 testified in the end. Also, just to go back to the internet radio, what we decided to develop as well was an psychological helpline for the victims who were following the trial remotely. So, because we never know how a victim completely alone in their home listening to the trial is going to react. And we thought it was important to also show them that we were there for these victims who were following the trial remotely, even though we were not present with them in their home. So there was this psychological assistance helpline that was open as well. And my final point of focus point would be the protection of victims, so to protect. Within the jurisdiction, there was an entire dedicated space for civil parties that was created inside the jurisdiction, which encompassed the main courtroom, a break room that was set up by the local victim support association, Paris Aide aux Victimes, where the civil parties would be able to go and have informal discussions between themselves, but also with the victim support workers. That was only accessible by civil parties. So this entire dedicated space was only accessible for civil parties who had a badge. And these badges, they came with colored cords to also protect them from unsolicited requests by the media. So if a victim had a green cord with their badge, it meant that they were okay with speaking to journalists. If they had a red cord, that meant that they did not want to be approached. And we also had sanctions planned for journalists and the media who would not respect the victims' wishes. But it was well followed, and we had no issues in the end. But this was an issue that we noticed during a previous trial, so unfortunately another trial for terrorism that happened a couple months before, the trial for the terrorist attacks of January 2015, where a lot of victims were apparently approached by the media when they did not want to be approached. So that system was put together to protect the victims as well. So my point is, I did not want to mention all of this point not only to enhance the lessons learned, but also to insist on the importance of having a support system put in place well in advance. You need to have recurring contacts with victims, send all of the information way before. I did not mention it because it's going to take forever, but you have to forgive me. But during the preparation phase, the local Victim Support Association in Paris, along with the services of the jurisdiction, they created a vademecum for civil parties, where you could find all of the practical information regarding the courtroom, how to get there, where they could find the services, where to go, what to do, with the relevant phone numbers and contacts. All of the information related to them coming to the trial was in this document. Also, they contacted the local Victim Support Association. They contacted the victims twice. They sent a questionnaire to know whether they would attend or not. They prepared visits of the courtrooms, several visits of the courtrooms, so the victims would know where to go and what to expect. So what I want to say is that it's really crucial to prepare as much as possible, not only for, obviously we want things to go smoothly, but mainly for the victim's peace of mind. And we saw that all of this preparation was not time that was lost. And I mean, the trial is, it's a difficult time for victims, and some were relieved at the end of it. Some, had a difficult time living through this process, but the fact that they had all of this information well in advance, that they had all of these contacts with the Victim Support Association, that created a bond of trust that made things easier for them, or at least that's what they expressed to us. So we consider this as a good practice now, and we've used this model to decline it for other large-scale trials. This is the basis of our work for the trial of the attack in Nice, as you were mentioning, Sue, that started last week. On the 5th, is it still last week? I'm lost, I'm still jet-lagged. It opened on the 5th of September, and this attack is also really specific, and it has other needs that I'm not going to get into, right now, because you have the competency of the place in Paris, and then it's being retransmitted in Nice, where the events happened. But all of this serves as good practice, and for us to still improve and know what we can do to help victims as much as possible. And I'm going to finish with that promise.
Thank you.
But
I'm sorry, I thought you were...
No, it's fine. Just one last point, because I think it's important, and then I'll leave it as that. But this internet radio for the trial of the terrorist attacks of November 13, 2015 in Paris, it was not available abroad and in English or any other language for that matter, because it was a new mechanism that was put together as fast as possible, and we had to cover issues regarding cybersecurity. All of this has been settled now, and for the trial for the Nice attacks, now the internet radio is available from abroad and in English. So that's already an improvement in a short amount of time. So we're striving to improve, but at least, unfortunately, when you have such events, we can still see our capacity of adaptation and resiliency for victims. So hopefully that would be a good point, a good thing for victims.
I have about 10 minutes left. So Mary and Anne, but I think you raised such an important, you spoke to it earlier, Mary, about who do victims trust. And when we talk about building trust, which is, if I listen to my former law enforcement colleagues, the top 3 priorities in policing are public trust and confidence, community engagement, and member support. And so we know there's a link to all 3, particularly member support as well. And you spoke about it in terms of some of the first responders. But I wonder if I could get each of you to speak kind of in some of those key lessons learned, but around why it's so important that civil society, victim serving agencies are involved in your pre-planning, are involved in not just getting their input, but are involved in the actual implementation and then the evaluation after, which is very large of what Voices does. I wonder if you could speak to some of that.
I'm going to have Anne go
Sure,
first.
go ahead, Anne.
Yeah.
Yeah, I think trust is immensely important. Also because terrorism and terrorist attacks, they attack a society, they attack values, but they also want to make sure that people don't trust their governments anymore. And I think with a lot of victims of terrorism being in Belgium or abroad, it is that feeling of isolation, of nobody was there to protect me, or should this have happened, or why is nobody coming to offer me support? That feeling of isolation feeds into what terrorists want, the mistrust in government, the mistrust in the system, in the system of values. So I think we need to be aware of that. Also that a traumatic event, trauma in itself, psychological trauma, has as an effect that people have less trust in other people, in people that surround them. So I think building on that trust is so important. When I think about the Belgian situation, I've seen it from the civil society lens. I've worked a lot with a lot of the individual victims in Belgium, so I've seen how difficult it is for them to look at what happened and see, did the government do enough or not. I think part of that, gaining that trust, is us also explaining what the government is doing, because there are plans in place, especially for this emergency response. We are at the table. Now I'm at that table. I can see what's happening. But I often tell my colleagues now, we have to tell people that we are here. We have to tell people that the plans are there, because a terrorist attack is chaos, especially in these first moments. And a lot of people, first responders of all kinds, come to the scene trying to help people. But if you're a victim, often you don't see who is there. You don't understand that there is a system. You don't understand that people have tasks and are doing what they can. So I think explaining what is there, but also explaining what we're doing to make it better. And that links to also accountability. We need to, I think, and not everybody thinks the same way in government sometimes, but I really believe that trust can only be built if you own up to the things that you didn't do right. It's not a shame, and I think for me, I often look at the French government and French organizations. Every attack, they've changed policy, they've changed procedure every time. Sometimes in a couple of months, things have shifted because they saw this is not what's best for victims. And I think that is something that we need to take away. And maybe a last point is that collaboration. I think one of the big lessons learned after Brussels is that people were on the scene and didn't know each other. So a lot has happened, and the government and my colleagues were instrumental in that, in making sure that people sit around the table, that everybody knows each other now. We're a tiny country, so it's possible. But so I think that is that we know who we should talk to, because in the crisis you don't have time to meet people. And a wise man, John Parkinson, once said at length, trust, you can't search trust. And I take that with me. You have to build it in advance. And I think that is one of the big lessons I've learned in also emergency response, that it's our responsibility to do the work in advance.
Mary, maybe a few comments on trust, but also any other comments you have. We're winding down to the last 5-6 minutes, so any other major comments that you want to make?
A couple of things. I think the preparedness piece is really important. Time and time again, even if it happened today, you would see someone on TV saying, we never thought something like this could happen in our community. And I say it can and it will. And when communities are unprepared, when they don't have any planning in place, you need to know where the medical examiner is, where's your trauma hospitals, who's the person that's going to be handling the media. And this all has to be done in advance. And in the emergency management world, they say, when a tragedy happens, you throw out the manual and you call the person that you can rely on. Well, sometimes that person doesn't have the correct skills. So I remember in Newtown, Dan, you were there too, but a day later, there was every imaginable language, on the street of trauma experts that were coming in as gurus to give advice to a community that really didn't, I don't think, benefited from it. I think the other thing is, even at the clinic, I was a proponent of continuity of care. And trust is really built on continuity. I've said it to my own staff or to people that we work with. If somebody comes to you with whatever the situation is, you own it now. And you have the responsibility, if you can't answer their question, to connect them with somebody that can. And there has to be that handoff. That doesn't happen very often, after these tragedies. I know myself, I'd call such and such to ask, X, Y, or Z, and you'd go through the whole story, who you lost, where you worked, all that. And then the end of the conversation, I'm sorry, we don't do that. And no response in how they can connect you. The other thing I think is to be familiar with, I think the people that have gone through it, no matter what it is, are experts based on their personal experience. It might be a different type of tragedy, but they understand the loss, they understand the consequences, they understand what people need. And I think that's one thing that we've been able to provide as an organization, is that continuity. So if somebody calls our office today and says, I worked in Lower Manhattan and X, Y, and Z, we would know, everything that they could possibly have gone through. And we would still have the relationships with the agencies or organizations that may be able to help that person. And I think that when a tragedy happens, you can have hundreds or sometimes thousands of organizations that are doing their slice of what it is, sort of operating in their silos, so to speak, and not looking at it holistically. And so then they're always pointed in a different direction. And I don't really know the answer to that other than organizations like ours that provide that long-term support from the beginning, have established relationships that we've continued to maintain, and people have that trust in us that they can contact us. We just got a call about a month ago from a young woman who was in a shooting in 1988 in South Carolina. And she read about what we were doing, and she said, the shooting happened on a Thursday. The assistant principal, and janitor cleaned up the school. They reopened on Monday, and they never talked about it. Now it's 34 years are coming up. So we started having a support group, peer support group for them. And the first meeting that we had, in fact, everyone that was on the call had never talked about it before. 34 years. But I think they trusted us because we know what that process is like. And they felt that we could, and we, certainly out of our realm of work, but how could you not? And so I think that's really important to be able to think outside the box, and it's much easier to do if you're a nonprofit.
Well, I notice I'm down to 1 minute and 10 seconds, so out of deference for the next group that's coming up, I'm just going to capture a few of the things, and I wish you had hours to spend with these three people because there's so much knowledge and so much lessons learned. But I think the best example I can give you is, I recall when we started the Link Alumni, John, back many years, and I do want to point out for the group that our president, Chief James Raymer, is here from Toronto, so for the ones that joined us after lunch. Am I supposed to say, John, we also need their email so that we can send them the invite to the next conference in Las Vegas? Am I supposed to say that? Or, one of the things that I really want to say to start by finishing off is you've given us so much on lessons learned, and pre-planning has come across loud and clear. More importantly, the victim-centered approach. Because at the end of the day, I quote a former colleague from the FBI when she says, that, well, many of you will know Catherine, but she puts up a slide that says, when a tragedy happens, be it criminal in nature or not, you will largely be judged on how you support the families, the victims, and the people who have been impacted. And there is no truer statement when you look at, and it's also, that's the way it should be in how you do that. You all have jobs to do, but at the end of the day, the other is the link to member wellness. You don't, people, we know that be it first responders, be it police, fire, if they know that the people who have been impacted, that they were with at their worst moment, their loved ones, that they're getting the support they need, that may help them with their coping and their resilience. But also, we also know that, as Mary says, there's been much research done, and I know I've looked at some of the work you've done as well. The impact can come up much later. And for you, all you leaders looking at member wellness, I know that's a key priority for you. So all of the knowledge that we get to glean, and I think the best example is the Link alumni coming together with INVICTM, with Voices, is really the best example I can say to you. If you don't think that we can't pick up the phone and say, Mary, we just had this issue in Saskatchewan, we just had a major attack in Saskatchewan, Susha's gone out there. We can call anywhere in the world on those relationships, and that's what you get with the Link program, with the Link alumni. But it's really understanding that you need all those lenses if you're truly going to have a victim-centered response, and not just to, I consulted with victims advocacy groups. No, you need to have them involved, and that's what we do with the Link alumni. Very much part of the, what did John Miller call it this morning, the entire machinery. And it's understanding that you need all of those lenses. Like if you haven't heard, you just heard a little bit about what France Victim is doing. That's what we do on an international basis, but we share it with all the police leaders, with Voices and all the experts, and we pull on that to help us, because there are so many lessons learned through so many tragedies, and we all need to have a responsibility to make sure that we make action and we turn that action, into positive change, such as your comments, Anne, with what France is doing. And so I couldn't think of a better example, but I'll proudly tell you that since the Link alumni started our annual conferences, we have always had a victims panel. And it has evolved, and it has evolved with the support of the leaders, the understanding of how important that victim-centered approach is. Because actually we did an article for IACP, Vince was here earlier, but we basically said it's a bridge, victim-centered approach is a bridge to public trust and confidence, to community engagement, and to member wellness. And so this is what, if we are truly going to have healthy and safe communities that understands that we've pre-planned for this, we've worked together, we've pulled the best evidence together. Nobody's expecting first responders to be the answer to everything, but you do hold the key. You hold the key to open the door for those who need that help, and you have a tremendous amount of expertise that's available to you, and you should be thinking about that ahead of time. And I want to finish with one comment about, I read Pathways. I was reading when I read one line, and it was in an ICP article, Pathways to Healing, and it said this. It said, victims are partners in public safety. Yes, they are. And I'm going to give you 3 quick examples. You're going to hear tonight from the 9/11 Commission. You've heard a bit about what the families did to push for the 9/11 Commission and get those recommendations. Basically, you have a victims advocacy families that led to intelligence reform in the United States. Secondly, we had the privilege to listen to Figan Murray, and Figan is actually in town. She was presenting at the UN. For those in the UK know Figan very well. And she pushed for Martin's Law, which is to bring about the prevent aspect and the responsibilities, and that's expected to go into legislation. And third, I know Maureen's back there, Maureen Baznicki. Where's my mosquito back there? The Muskoka Mosquito, she calls herself. Maureen is an advocate in Canada, and Maureen has led to legislative change with S7. She is, Victims' Day of Service, and I could go on. So I thank you, Maureen, for the change that you've made in our country and continue to make. And so I just would say to you that you need to have the victim's voice. You need to have them. They need to be heard. They need to be involved, and you should be leveraging everything you can to learn from them and to develop your pre-planning and your processes. So when tragedy does happen, you're prepared. So I'm going to leave it there because we could go on. By the way, I picked up my pace on speaking. I apologize. I was much slower this morning. So I just want to say thank you to the panelists, and what an honor and a privilege it is to work with them.